Welcome back mga kasambahay! Ngayong araw ay pag-uusapan natin ang tungkol sa fatty liver. At para sa mas malawak at mas maintindihan pa natin ng maayos ang tungkol sa fatty liver, we have invited a distinguished guest who will shed light on a topic that's becoming increasingly prevalent about fatty liver. Without further ado, let's extend a warm welcome to Dr. Frederick Leelin, a gastroenterologist from Makati Medical Center. Good morning, Doc Fred, and welcome back here at Doctors on TV.
Glad to be here, Sarah, again.
Yeah, and you might want to greet our mga viewers po, no, na nakatutok sa atin ngayong araw.
Well, first, I'd like to make a little disclaimer. This is not a zombie episode. I recently just had some surgery on my eye. That's why it's a little bit red. Maybe I'd just like to greet my ophthalmologist, the very able Dr. Dennis Cruz, for doing a good job. So this is worse than it looks. I'm able to see very well. Good morning, everybody. I'm glad to be here again with you, Sarah.
Yeah, and of course, with this constraint, thank you very much for giving us time pa rin, Doc, no? And with this, marami po tayong matutulungan. And it seems that you are recuperating well, Doc, because you won't be able to make it here kung hindi maayos ang inyong condition ngayon. Thanks
Right.
again. And again, ito, Doc, no? Okay, so going back to fatty liver. So, Doc, can we elaborate it sa ating mga viewers? Pag sinabing fatty liver disease, what exactly is it po?
Well, our goal here is to talk simple and easy to understand. It's basically a condition wherein there is excessive accumulation and deposition of fat onto the liver. That's what it is, fatty liver disease. And because of that, two things will happen. One is that the liver will get inflamed. If you look at the course of the disease, the second phase, the liver gets inflamed. The third phase gets fibrosed or titigas. No?
Or nagpepeklat?
Yes, nagpepeklat. And finally, you will get what you have, the end-stage liver disease, which you call chronic liver disease already, which is liver cirrhosis. And the ultimate thing that we want to prevent here is liver cancer.
Oh, okay. So basically, hihimayin natin yan, Doc. So basically, hindi pala natatapos dito sa fatty liver per se. Okay, so marami siyang mga worse complications or worse consequences later on. But kanina yung sa unang na-mention yung, Doc, no? So basically, there's increased production ba? Did you mention that? Or increased accumulation?
Well, it's the term that we use in English, no, in the medical field is called metabolic syndrome. Which basically means that the individual suffers from several factors. One is obesity, which is that's how you get the fat to come in, you know, it's deposited onto the body and onto the liver. Blood sugar is deranged usually, and because of the obesity as well, in tandem with that, the cholesterol, which is what these people know about what cholesterol is elevated, and there is also lifestyle factors that deal with it, like specifically alcohol intake.
I see. Okay. So basically, ito bang fatty liver, Doc, may mga types din ito?
Yes, there's basically two separation. There's one wherein you only have fat deposition onto the liver, nadidepositohan ng taba yung liver. And if you move onto the other side, which is wherein you get inflammation, namamaga, you call that hepatitis. So you get fatty liver, and then you have fatty liver with inflammation.
I see. Okay, so and we have to reiterate lang na yung hepatitis kasi minsan ang kalimitang alam nila would be yung viral, no? Yung
That's
nakukuha
correct.
na from the hepatitis virus. But this one, pwede pong mamaga ang liver, okay, secondary to fatty deposits. Okay,
Yes.
fat deposits. Okay, and ano eksaktong cause nito? I mean, you mentioned about having hypercholesterolemia or mataas ang cholesterol level. So with that, Doc, ganong katagal yung level na mataas ang cholesterol before may studies ba na nagsasabi na before siya mag-manifest as fatty liver already?
Well, I'll answer that by saying the hepatologists here in the world, and also specifically here in our country, are saying that fatty liver disease is about prevalent in about 36-35% in the world. The age range wherein you get it, if you're interested on how long before you get it, seems to be getting younger and younger. Here in our country, they estimate that it's about 20% of the people have fatty liver disease, which wasn't really the case before. So now we're seeing it more and more. And the basic problem that they're saying here is it's not really being truly recognized because there's one factor that prevents that. Fatty liver is usually, most of the time, painless. You don't feel anything.
Unless nagkaroon na ng hepatitis or pamamaga later on.
Well, you can have a little inflammation in the liver and then you can feel something. But for most cases, no, there's no symptoms, so people won't have it checked. So there should be some awareness, some advocacies that should be done about it to make the people aware that there is this, we call it silent type of disease, fatty liver disease.
So does it suffice to say that when you see the patients who suffer from fatty liver, usually nasa mga severe stage na yan?
No naman. Usually, the reason kung bakit sila pumupunta sa doctor is because of a blood test that they are usually asked to do. And the name that it's called, well, I'll just abbreviate, is the ALT. It used to be called SGPT, if you're familiar with that. And they get that blood test from their doctors and they see that it's elevated. And then they start testing. So
that's when?
That's when.
Okay, so parang basically, papasok dito na incidental finding yung dito sa fatty liver.
Yes, because you don't feel anything eh.
Yeah, okay. So, pero sometimes na mas maganda pa rin pag may pain eh. I mean, generally speaking, kasi it signals that there's something wrong, okay? Pagka merong pain, meron siyang sinisignal na, so there's something wrong and mas maaayos ng patient. So anyways, because of an elevated liver enzyme, just like what you said, yung SGPT po, no, dahil mataas siya, so nagsa-start na nga ng workup ang patient. Okay, and di ba, Doc, we'll get there sa mga diagnostic measures later on. Okay, and apart from increase in the cholesterol diet or fatty diet of patient, what other risk factors yung meron po that can put the patient in this condition?
Yes, it also includes, usually the profile here is that there's hypertension, there's an elevated blood sugar, no? And then as we mentioned, yung cholesterol nga is mataas, no? And then usually their lifestyle is that of sedentary, okay? And their diet that they take is the very fast food, milk tea, quick fix, poor nutritional value food that because of the fast pace of our life and limited choices in the grocery, no? When I say limited, to eat healthier can be sometimes more expensive. It's cheaper just to eat the regular oily, low nutritional value food. And then that pushes you, all those factors, hypertension, bad cholesterol, high blood sugar, lack of exercise, that all leads to create this silent epidemic.
So, basically, lahat ng minention mo, Doc, they all boil down to poor lifestyle habits of the individual.
Yes, in fact, part of the first arm of the treatment of fatty liver disease is correcting the lifestyle. You should be able to psychologically motivate your patient to accept that they have this unpainful disease that is lurking in them, and in maybe 5-10 years, fatty liver can eventually lead to chronic liver disease, like I mentioned, and it is usually the main reason why people eventually, the 16,000 people that die from liver disease, it's because they had fatty liver in the beginning and then they end up with liver cancer.
That's so sad. Pero, Doc, ito, nung na-mention nyo about the lifestyle habit of individuals, so basically, we can say also that fatty liver disease can be prevented naman. It's preventable.
Very much. In fact, the liver can regenerate. It's the type of organ. So, not only can it be prevented, but when it's already there, it can be reversed. So, there's still hope that springs eternal.
Okay, so that means na during the early stage po, kaya pang mag-compensate ng liver because
Yes.
it's highly regenerating. Okay, so in the event na parang part of that, medyo injured because of yung fatty changes, no, in the cells. However, pwede pa siya. So up to what point that the liver can compensate? Just so hindi na siya makarating dun sa stage wherein wala, hindi mo na mahabol kasi pwede na mag-liver failure yung
Sige,
patient.
that would be very interesting to note, no? There's a imaging test that we do. It's called the fibroscan. Okay, and fibro comes from the word fibrosis, meaning how how hard or how peklat the liver is. Now, if you reach a certain stage, and let's simply use numbers, 1, 2, 3, 4. 1 being minimal peklat, 4 meaning sobrang peklat na yung liver mo. They say that if you get to stage number 3, it's very hard to go back. So you would like to catch these patients when their peklat is only at stage 1 and stage 2. No? The imaging technique that we do, the fibroscan, gives you numbers, and you play with those numbers to either bring them down or to prevent them from moving forward to become more peklatin.
Of course, it depends also on the determination of the patient. Kung gusto niya talagang i-improve yung kanyang condition na.
That's
okay,
correct.
Still, parang maglinger pa rin yung kanyang poor lifestyle habits. Okay, and ito Doc, no? So having mentioned that, syempre meron talagang, kaya talaga siya na umabot dun sa scarring and eventually hindi na maka-recuperate ang liver. Okay, but so can we expound on how serious fatty liver can be?
Let's talk about the ending, no? Cancer of the liver. It's genetically motivated, no? If you have a family history of liver cancer, then you're more prone to it. But usually the reason is simply two, no? One is alcohol, alcoholism, and then the other one is called cryptogenic. Cryptogenic is a fancy word for hindi natin alam kung saan nanggaling. So they are theorizing na aside from alcohol intake, all those who we don't know where liver cancer came from may have come from just simply fatty liver, which became inflamed, which became peklatin, which became cancer. So that's how serious the problem can be.
I see. And okay. So but like what you mentioned kanina, pwede naman siyang bumalik dun sa normal, but dapat early diagnosis pa rin, and early diagnosis so we can do early management as well.
Yes. Speaking of management, there are before you offer what we call medical management, no, there should be you have to first and foremost instill in them that the first thing that they need to do is diet and exercise and change their lifestyle. If they're taking alcohol, then you should address that problem. How much is too much? For males, it's 7 drinks a week.
7 drinks a week. So is that hard or the usual beer?
1 standard drink. So if it's beer, a bottle of beer, a shot of scotch, a jigger of tequila, or for women, it's less. It's 4 drinks a week.
So mas delikado ang female?
Yes.
Oh.
They are advised to take less alcohol because they are more prone to alcohol and fatty liver disease.
Is does it have something to do with the hormones?
I'm not so sure. Maybe it's because of the
Physical activities of men.
Maybe it could be that, or could be with the hormones. But women are allowed to drink less.
I see.
Amazingly. So you address that problem with their alcohol, and then you have to instill in them that the problem is not simply going to go away if you take a pill. No? Because some people, they just think that simply taking a medicine will make my fatty liver go away.
Yeah, if they think that they take some hypercholesterolemic agents, okay, ibig sabihin pampababa ng cholesterol level po sa dugo, ay feeling nila, hindi, pag nag-normal na, okay na.
Yeah. So, you have to educate them and sabihin na hindi lang yan magagamot ng, taking a pill. Plus, the pills that you take now for this type of fatty liver disease also have side effects. It's not simply that. They may not be effective, number 1. And number 2, as you take them, meron pang side effect yung
Sa
gamot.
liver also, di ba?
And the whole body as well.
A whole body. So, actually, yan nga yung dilemma eh. Will you be giving parang anti-hypercholesterolemic agent sa pasyente when, okay, the most common side effects would be, ang tatamaan would be the liver. Okay?
Yes.
Kaya ka nga nagte-take nitong, kaya mo nga nalaman na may fatty liver ka because nalaman mo na mataas yung liver enzymes. So, ibig sabihin may damage na to begin with. Okay? Kasi generally speaking, ang enzymes ay located intracellularly. So, nasa loob po yan ng mga cells. So, once may damage, saka po sila na nagli-leak out hanggang na nakakarating sa bloodstream. That's why nakikita natin elevated po sa dugo pagka in-examine. Okay? So, going back, so basically, Doc, mas okay talaga mag-lifestyle change.
Yes.
Kasi minus the side effects, diba, Doc?
Yes. Although I'm not saying na I don't give medications to my patients, but you always have to start with that as the awareness, understanding, and motivation for that. The guidelines say that the latest that they would like to give for this kind of fatty liver disease is in fact a vitamin. Vitamin E is what they are espousing now, that if you take that, that's the one that can help solve fatty liver disease. No? But then again, when I offer this to my patients, I tell them that before you take this medicine, you should embark on a lifestyle change, diet change, exercise program, and willingness to be treated. Meaning, your liver enzymes, as well as, we haven't mentioned yet, an ultrasound should be done so that we can assess how you're doing with the treatment.
I see.
So that's how it works. That's basically it. Now, vitamin E, given at a certain dose, also has side effects.
Yeah.
So you have to weigh this and keep
So it's
monitoring.
really just to check the pros and cons, basically, and it's a case-to-case basis.
Right.
Eto, Doc, I'm just curious, what has been the youngest patient with fatty liver that you have seen in your practice so far?
Oh, young. Some people in their teens.
Teens? So, alcoholic ba yan or non-alcoholic? Or both?
Usually, alcohol doesn't really play a large role, because it's modifiable. Once they know that they have that, it's not too often that we see that it's alcohol-driven. It's usually a conglomeration of things.
Kasi it's multifactorial.
Yes, the blood sugar is probably elevated. At that young age, they probably also have hypertension. They probably don't want to exercise. They just like to stay indoors. So, young. You can have young ones, but usually the diagnosis is made 40 and 50 years old.
Okay.
Start
More
seeing.
commonly. Okay. Naku, marami palang dapat malaman tungkol sa fatty liver, Doc, no? Pero, Doc Fred, bago pa po lumalim yung ating pag-uusap, pansamantala muna nating ititigil ang ating talakayan. Naku, mga kasambahay, dyan lamang kayo at magbabalik pa rin po ang Doctors on TV. Nagbabalik po ang Doctors on TV at para pa rin po sa pagpapatuloy ng ating talakayan, still here with us is Dr. Frederick Leelin, a gastroenterologist from Makati Medical Center. So bago natin ipagpatuloy ang ating pag-uusap, Doc Fred, mayroon po tayong pasyenteng lumapit sa ating programa upang makumpirma nga po kung ang kanyang mga nararamdamang sintomas ay may kinalaman sa ating pinag-uusapan ngayon na fatty liver. Naku, para po sa detalye, panoorin po natin ito.
Sa buhay, may mga pagkakataon talaga na hindi inaasahan. Tulad na lang ni Raymond, hindi niya tunay na pangalan. Sa pag-aakalang mataas ang kanyang blood sugar level dahil hindi gumagaling ang kanyang sugat. Ngunit ang lumabas sa laboratory results ay may problema pala siya sa kanyang liver.
Dapat kong ipacheck, napasok po kasi ako ng tambutso ng motor. Tapos 6 months na pong hindi gumagaling yung sugat ko. So, ipapacheck ko po kung normal po ba yung sugar ko or kung ano pong lalabas po sa laboratory. Kaso yun po yung na-detect na may fatty liver po ako. Tapos sabi po ng doktor nun, parang may mild daw po na pamamagana daw po sa liver ko po. In-advise po niya na iwasan ko daw po yung pagkain ng medyo matataba, matatamis. Tapos kasi nung time po nun, mahilig po ako sa mga ganun. Kaya yun po yung pinaiwasan niya po muna sa akin. Bali, nararamdaman ko talaga siya every na medyo straight na makakakain ako ng mga street food, mga mamantika, mga ganun. Tapos nararamdaman ko parang nanghihina, tapos masakit. Parang pinibigay yung dito banda ko. Nasin parang sinuntok yung bandang tagiliran ko. Ganun po yung nararamdaman ko.
Dahil hindi maiwasan ni Raymond ang pagkain ng karne o mamantika, pati ang mga street foods, kalaunay nakakaramdam siya ng mga sintomas na nagiging sagabal na rin sa kanyang pagtatrabaho.
Usually pagka as in 1 week na tuloy-tuloy yung ganun yung pagkain ko naman. Pagkain na binawal sa akin ng doktor ko noon. Doon siya nag-i-start na paunti-unti ko lang nararamdaman. Tapos hanggang sa as in masakit na siya. Nakakasagabal po kasi lalo na pag sobrang sakit, as in hindi ka makakakilos kasi iindahin talaga yung sobrang sakit niya. Kaya nakakasagabal po talaga. Gusto ko po ulit na magpatingin sa doktor about po dun sa nararamdaman ko. Kasi last 2020 pa po ako yung nagpatingin. Tapos ngayon medyo tuloy-tuloy pa rin yung nararamdaman kong sintomas. Pati para ma-assure na rin kung lumala ba or ano. Kasi hindi po ako nakapag-tuloy-tuloy ng take ng gamot po na nireseta po sa akin ng doktor nung last na check-up ko po. Nababahala din po kasi yun po yung mga nakikita ko rin po sa social media about po dun sa ganung sakit na fatty liver na hindi lang siya simple. Pwede rin siyang lumala na pwede rin mag-cause, lalo na liver yung maapektuhan sa akin.
Dahil sa nangangamba si Raymond sa kanyang kalusugan, nakipag-ugnayan siya sa programang Doctors on TV upang maipakonsulta ulit. At sa tulong ng Makati Medical Center at doktor, maayos na naisagawa ang kanyang mga diagnostic tests.
Okay, so ito Doc Fred, no? Kamusta po yung yung pasyente? I mean, yung mga risk factors and yung mga findings po, yung nung nag-history taking kayo and other examinations po that you had requested to come up with kung ano man yung diagnosis ninyo.
Sige, so basically this is parang typical tong pasyente na to. Very commonly seen, no? Bata pa siya, he's not in his 70s or 80s, no? He's a male. And noon, nasabihan siya na nalaman niya na meron siyang fatty liver. And usually, ang nangyayari dyan is hindi naasikaso o hinahayaan. Nga kasi, like we discussed earlier, wala siyang nararamdaman na masyado. There's very minimal to almost no symptoms from fatty liver disease. So, ang nangyayari is hindi binibigyan ng pansin. Finally, now, for some reason, they decide, iniisip nila na ipacheck ko kaya ito ngayon. So, pumunta siya and then in-examine namin siya. And most of the results will therefore come out dun sa mga test na ginawa. Basically, you do a blood chemistry, no? Titingnan mo yung roster ng kanyang mga blood chem na tinatawag. And then we also requested for an ultrasound, which is an imaging of the liver using sound waves. Okay, lumabas dun sa kanyang mga resulta na yung kanyang liver enzyme, which is elevated pagka yung liver mo mataba o kaya it is also inflamed, no, namamaga. Ang normal being in the 50s, yung kanya nasa 400. And how worrisome is that? We start to worry pagka yung normal, which is 50, like I said, umakyat siya ng 3 beses. So, mga 150 to 200. Yung patient X here, his level is 400. So,
That's really high.
that's really high. Although the liver enzymes in certain diseases can go as high as 2,000 or 3,000. No? But indeed, 400 for somebody who's not feeling anything is worrisomely high. The rest of the examination, we checked the blood sugar. It was within normal limits. The other factor that seems to be with him is that his cholesterol is elevated. Ang tawag dyan natin is yung taba sa dugo, no? Na ganyan. Mataas yung kanyang level doon, no? And lastly, he seems to be active naman at saka hindi siya obese, no?
Okay.
Obesity kasi is another factor that has pushed fatty liver into its level that we have now.
I see. Okay, Doc. So, if I may just cut you here, does it mean, kasi sabi nyo, this patient, hindi naman siya obese, okay? So, for the benefit lang na ating viewers, no, the cholesterol is really high, pero hindi siya obese. So, it really happens pala, Doc.
Yes, and the way we grade obesity is your weight as a ratio or dinidivide over your height. So it's called simply body mass index.
Yeah.
So short people usually are allowed less weight, no? Taller people are allowed more weight before they are termed obese. So some people nga say, I'm not overweight, I'm just short for my height, no? I just lack height, na ganyan.
The height becomes an excuse.
Yeah, na ganyan. So he wasn't on the heavy side, no? His BMI was in normal limits, but his cholesterol or yung taba sa kanyang dugo mataas, and just like the fatty liver, cholesterol also has a tendency to have no symptoms. Yun. So it's awareness and follow-up. He knew it 3 years ago, and then now he decided to have it checked.
He didn't do anything for the past 3 years?
No. Ang takbo kasi niyan is, ba't ako magpapatingin? Wala naman akong nararamdaman, no? And then there's that usual adage na ikaw kasi patingin ka ng patingin kaya merong nakikita sa iyo.
Dapat ka nagpapacheck up para wala ka malaman.
Yeah, di ba? Ignorance is bliss sometimes. Ganyan. So, he's very typical. And then finally, when we did do the ultrasound, we requested for the ultrasound, the imaging, it was read for him to have fatty liver disease.
I see. Okay, so having all these results, okay, sa mga pina-exam po. So ano basically yung naging medical advice, and what would be the management protocol here?
Okay. Well, we would like to see him not on a weekly basis, and we don't usually order the blood test for the SGPT, which was elevated after 1 week or 2 weeks. No, usually we allow 6 weeks or 2 months to pass before we check it again. We enjoin him to still try to make his diet. We sometimes consult a nutritionist to give him advice on how to properly take in food that is nutritionally better than what he was taking before. Usually, you would like to have them make healthier choices, less oily choices, and quick rule of thumb, pag masarap, usually bawal. Pag meron kang nakain,
But isn't it subjective, Doc? Kasi baka mamaya, for me, ang masarap gulay. Nangyari lang.
Baka you just suffer from poor taste. Di ba?
Okay.
And then, this is sometimes the type of patient, because at that level, I would be concerned. I would ask him to do a fibroscan, which is another imaging technique to see not only if the liver has fat deposition, but if the liver has areas that are already showing signs of being peklat or scarred. Yung ganyan.
Kasi ito na yung hindi matitreat, no? Itong mga parts ng liver na ito na scarred or may peklat na, hindi na yan mag-regenerate.
Yes, if it has reached a certain stage, like we said earlier, baka hindi na siya matreat. So, you would like to see his, well, it's called the fibrosis score, no? Now, lastly, what you would like to do is to know how bad the liver disease is. And there's one surefire way to know. Unfortunately, it is called a liver biopsy. And not very many people
would go for that.
Not even the hepatologists would have many of them doing that. But that is the gold standard to determine how severe the disease is, whether you should be worried, whether you should be aggressive. And usually, most of the data that comes out about fatty liver disease is based on liver biopsies. What do I mean? Meron kang liver biopsy ngayon, masama yung liver mo, iti-treat ka with whatever treatment, and then iba-biopsy ka uli para malaman how the treatment went. So that's 2 biopsies to see how the treatment went. So it's very seldom that our mga kababayan will have them subjected to
I know, di ba? Parang baka they'd rather, okay, from now on, talaga, I will be determined, I will be compliant, susunod ako sa doctor, and then that's it. Pero to undergo, parang like a biopsy, no? So, no way, baka yun ang sasabihin nila, Doc. Okay, Doc, ito, sige. I'm just curious, kasi you mentioned about the fibroscan, no? I mean, not dito sa ating patient since hindi pa siya nakapag-undergo nito. But in the event na what certain percentage of a scarred liver tissue would be enough para masabi natin, ako, parang we cannot do anything about this anymore. And I understand some would would opt for a liver transplant. Is that so?
Well, that is usually what you offer to people who have end-stage liver disease. Because you cannot do any more medical management when you have a majority of the liver fibrosed. Maybe if 80 to 90% of the liver has been affected, then that's when you say that the patient can therefore now opt to have a liver transplant.
Pero mahirap, Doc, di ba? Una, the donor.
Well, my center is embarking on a liver transplant program. So we are in the process now of sending out our hepatologists, our surgeons, our anesthesiologists, our interventional cardiologists, everybody to come together to come up with this program. But that is already when you have end-stage liver disease.
Yeah.
Now, maybe what we should put out there is that this disease can be reversed, it can be prevented, it can be controlled, it should be made aware of. There are other things that you can do before you reach that point wherein you have to, deal with something that's super specialized already.
I see, okay. And of course, marami ring risks yan di ba? That come with the procedure, okay. And Doc, how about, okay, so in the event na parang hindi magiging option yung liver transplant and say, we'll really go for the medical management alone. I mean, what complications may arise, okay? In the event na hindi na po maayos, okay, o dahil basically a large percentage of the liver has been scarred already.
Okay, usually, to answer that, ano ba ang nagiging, let's call it the ending of this disease entity, no? It's usually malnutrition. Because the liver is the source of nutrition, no? If you lose that organ because of fatty liver disease taking off, scarring happening, and eventually leading to cancer, you get very, very malnourished. So the medical management is nutritional support, no? You start to give them all the proteins, the calories that they need, the proper calories that they need, so that they can support something that an organ that is diseased cannot do anymore.
I see. So this is very sad naman. But siguro we just have to take note that this fatty liver condition is highly preventable, di ba, Doc? So basically, ito na lang, pigilan na lang natin magkaroon nito, mga kasambahay. And with that, Doc, do you have any final words para sa ating mga viewers?
Well, I'd just like to put it out there that it's the impact of fatty liver disease is being compared to close to COVID, the amount of impact that it has had on the world, no? But if you look at the attention that COVID got and what fatty liver got, you can see that there's a disparity, di ba?
Yeah.
So, not that I want people to get fatty liver just like they got COVID, but maybe I would like the population to be made aware of it, my colleagues, my patients to be made aware of it, that there's this type of disease for the liver, that we can treat it, we can be made aware of it, and then hopefully we can make it better and eradicate it.
Oh, very well said, Doc. And you might want to invite our viewers to visit you here at Makati Medical Center.
Oh, sure. We'll be happy to take care of any of your problems when it comes to gastroenterology and hepatology. We have our endoscopy and hepatology center here at Makati Medical Center. Feel free to see any one of us. We have a website, we're online. I enjoin everyone to take care of their livers and have a healthier life ahead of them.
Thank you once again, Dr. Frederick Leelin, a gastroenterologist from Makati Medical Center. At ngayon, mga kasambahay, dako naman tayo sa ilan pang mga impormasyon kung mayroon bang natural remedies to prevent fatty liver. Alamin natin yan sa Naturally Yours.
Magandang umaga. Ako po si Dr. Ruiz at samahan niyo ako at pag-usapan natin kung paano ba tayo makakaiwas sa pagkakaroon ng fatty liver. Paano nga ba nagkakaroon ng fatty liver? Ano ang mga pagkain na maaaring magdulot ng fatty liver? Pag-uusapan po natin yan ngayon. Pag sinabi nating fatty liver, ito ay tinatawag natin na sobra ang taba at nababalutan na ang ating liver. Ang liver kasi, yan ang tumutunaw sa mga toxins na pumapasok sa ating katawan. Subalit, kapag sobra na ang taba na ating na i-intake o nakakain, ay yan po ay bumabalot sa ating liver. Meron tayong tinatawag na alcoholic at saka non-alcoholic fatty liver. Yung alcoholic fatty liver ay sa kadalasan doon sa malalakas uminom ng alak. Ang alcohol kasi is fats na siya namang sobrang fats ay bumabalot sa liver. Ang tinatawag naman natin non-alcoholic, yung nagiging fatty liver na sobra naman ang pagkain natin ng kolesterol. Kung kaya't nababalutan ang ating liver, hindi na siya masyadong nakaka-function. Paano ba tayo makakaiwas? Number one, importante rin yung tinatawag na human microbiome. Yung mga bakterya na naandun sa ating tiyan. 90% ng bakterya natin sa tiyan ay tinatawag nating mga good bacteria or probiotics. Pro meaning pro for life biotics. Ang bakterya na yan ay talagang doon na nakatira sa ating tiyan. Meron tayong tinatawag na good bacteria at merong bad bacteria. 90% ng ating bacteria sa loob ng ating katawan ay dapat good bacteria. Hindi pwedeng wala tayong good bacteria. Saan natin nakukuha yan? Doon sa mga gulay, sa mga burong ampalaya, burong mustasa, doon sa ating tinatawag na apple cider vinegar, katulad din ng ating bigas. Yung ating rice, nababalutan ng brown rice, black rice, ayan ay maraming good bacteria. Ngayon, paano nakakatulong itong mga good bacteria, pag-take ng good bacteria, upang maiwasan ang fatty liver? Merong particular na good bacteria na kinakain niya yung mga excess fats, yung mga bad cholesterol ay kinakain nitong bad bacteria. Kung kaya't, naiiwasan natin ang pagkakaroon ng fatty liver. Kung kayo meron ng fatty liver, naaayon lang na mas maganda rin mag-take ng mga probiotics upang sa gayon, hindi na dumami ang mga taba sa ating liver. Ito po yung mga tinatawag natin katulad ng bioenzymes. Ito po ay isang probiotics na tumutunaw upang sa gayon ay maiwasan na ma-absorb yung ating mga taba sa ating katawan. Meron ding tinatawag na para mapababa ang kolesterol, yung Rex-active probiotics. Although yan ay galing sa France, ini-import pa yan at ibinibigay yan dito. Ito yung mga supplement na ating nagagamit sa ngayon. Isang kapsula nung tinatawag nating Rex-active or bioenzyme ay katumbas na halos ng 1 kilong burong gulay na ating tinitake. At I hope marami kayo natutunan sa pagkakataong ito. For natural tips, stay tuned dahil natural is beautiful only here at Naturally Yours.
Mga kasambahay, ugaliin po natin i-prioritize ang ating mga kalusugan. Due to fast-paced life, it's easy to ignore checkups, but don't let your busy schedules sabotage your well-being. Prioritize self-care because a healthy you is the best version of you. And with that, may pag-uusapan pa po tayo maya-maya. Naku, yan po ay sa pagbabalik ng Doctors on TV. Nagbabalik ang Doctors on TV. Mga kasangbahay, bago tayo pansamantalang magtapos, ilang tips po ang aming ibabahagi sa inyo. Para naman sa mga kababaihan, makinig po tayong mabuti dahil baka ikaw na ang nakakaranas nito at naku maaaring di lang natin napapansin. Alamin natin kung ano ang mga dahilan ng pagkakaroon ng fatty liver sa mga kababaihan. For the details, let's watch this.
Good morning mga kasangbahay! Alam nyo ba na maaari rin magkaroon ng taba o fat ang ating mga atay o liver? At apektado nito maging ikaw man ay babae o lalaki. At ngayong araw, we are going to tackle about fatty liver in women. Hello, I'm Dr. Charmaine Beleno, isa po akong General Medicine and welcome sa Women's Health. Ang fatty liver disease ay isang kondisyon kung saan nagkakaroon ng sobrang taba ang ating atay. Mayroong dalawang klase ng fatty liver disease. Ito ay tinatawag na non-alcoholic fatty liver disease at alcoholic fatty liver disease. Ang taong high risk sa fatty liver disease, unang-una na ay ang mga taong obese or overweight. Pangalawa ay ang mga taong madalas umiinom ng alak or ang tinatawag nating alcoholic drinker. Pangatlo ay yung mga taong merong endocrine or metabolic syndrome gaya ng diabetes or thyroid disease. Sa mga kababaihan, common din ito sa mga taong mayroong hormonal problems gaya ng polycystic ovarian syndrome. Ang taong may fatty liver disease ay maaaring makaranas ng panghihina or madaling pagkapagod. Maaari rin silang makaranas ng pananakit ng tiyan or discomfort sa kanilang tiyan, lalo na sa bahagi ng atay. Ang isa pang simptomas nito ay ang paninilaw ng balat or jaundice at maaari ring makaranas ng pangangati ng balat or itchy skin. The causes of fatty liver, unang-una na is yung lifestyle. Kapag ang tao ay overweight, lalo na obese, ang isa pang cause nito ay ang pagkakaroon ng sedentary lifestyle or hindi masyadong active sa kanilang pamumuhay. Ang isa pang cause ng pagkakaroon ng fatty liver ay ang ating diet. Kapag tayo ay madalas kumakain ng oily at fatty meals at mga matataas na cholesterol na pagkain. Ang pag-inom ng alak or ang pagiging alcoholic drinker ay nakakakos din ng fatty liver disease. Mayroon ding pagkakataon na ang ating genes, lalo na sa kababaihan, dahil meron tayong female hormones na nakakaapekto din at maaaring mag-cause ng fatty liver disease. Ang fatty liver disease ay reversible. Maaari natin itong magamot, ngunit kung ito ay ating pababayaan, maaari itong mauwi sa scarring or pagkakaroon ng peklat ng ating atay na maaaring mag-cause ng pamamaga ng ating atay or tinatawag na hepatitis. Kapag lalo nating pinabayaan, maaari rin itong mauwi sa liver cirrhosis na tinatawag or ang end-stage liver disease kung saan nawawala ang normal na function ng ating liver. Unang-una, maganda na magpakonsulta sa doktor upang physically ma-assess ang ating atay, ang ating mga simptomas. Maaaring mag-order ang ating doktor ng mga laboratory test gaya ng liver function test na tinatawag SGPT, SGOT at bilirubin. Ito ay mga liver enzymes na tinatest. Maaari rin whole abdominal ultrasound. Upang maiwasan natin ang pagkakaroon ng fatty liver disease, mahalaga na baguhin natin ang ating lifestyle, magkaroon ng lifestyle change. Kung ikaw ay overweight or obese, magbawas ng timbang, maging active at mag-exercise. Pangalawa ay ang ating diet, iwasan na kumain ng mga matataba at mamantikang pagkain, iwasan ang mga matataas sa kolesterol na pagkain. Pangatlo ay umiwas sa pag-inom ng alak. Mayroon tayong mga oral medication upang makatulong sa pag-normalize ng ating mga liver enzymes at upang makatulong mag-improve ng function ng ating atay. Ang pangkaraniwan na gamot na iniinom upang magkaroon ng normal na liver function ay phospholipid or silymarin, pero mas maigi pa rin na magpakonsulta sa ating mga doktor. Ang mga pagkain na maaari nating kainin upang makatulong sa ating fatty liver disease ay oatmeal dahil ito ay mataas sa fiber na makakatulong sa ating digestion at makakatulong na makapagpababa ng ating timbang. Pangalawa ay ang mga green leafy vegetable or yung mga gulay na kulay berde. Pangatlo ay isda or fish dahil ito ay rich in omega-3 fatty acid na maganda sa ating pangangatawan. At pwede rin tayong uminom ng green tea dahil ito ay mayaman sa antioxidant na makakatulong makapaglinis ng ating toxin sa katawan. At kung mayroon po kayong katanungan or nagnanais po kayong magpakonsulta sa akin, maaari niyo po akong i-message sa aking social media sa aking Facebook, Doc Charm Beleno. Muli, Ako po si Dr. Charmaine Baleno. Palagi po nating tatandaan, lalo na sa ating mga kababaihan, that our health matters. Maraming salamat mga kasangbahay.
And with that, we conclude today's enlightening episode. At ang lagi po naming dasal sa lahat ng mga may pinagdadaanan, lalo na sa kanilang mga kalusugan, may God bring healing and guidance to each one of you, mga kasangbahay. Always remember, early detection saves lives. Make your health a priority. But before we end, take a moment to watch this.
Watch these snippets for the upcoming episode on Sunday.
Yung yung kidney, ito yung tinatawag natin, yung common sa tao, no? Yung bato. Ito yung mga nagfi-filter ng mga lason sa katawan na tinatapon niya sa ihi. Iyon basically ang main function ng kidney is para ipunin lahat ng lason sa katawan at itapon sa ihi.
At yan po mga kasambahay ang aabangan natin sa susunod na linggo. And as we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their unwavering support. And I would like to greet Kuya Daniel Razon na wala pong sawang sumusuporta sa mga adhikaing serbisyo publiko. And to our BMPI's General Manager, Mr. J. Eusebio. May God always protect you both and grant you a healthy life. And syempre, binabati ko pa rin ang aking kambal, si Iya, and syempre, hi kay EJ and kay Doc Alamin, and ang mga pasyente natin sa Barba-Cabodil Health and Wellness Center. Also, nanay and tatay, I love and miss you both very much. And also, hi to BMPI's group of companies, especially to VP Nolly, VP Joseph, and VP Bong. And sa KDR group of companies. Hello po sa inyong lahat. And sa ating mga kasambahay, maraming salamat po sa patuloy ninyong pagtangkilik sa Doctors on TV. And please like and follow my Facebook page. Just type on Facebook search box, Dr. Sara Barba-Cabodil. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, magandang umaga sa inyong lahat at marami pong salamat. Ito po si Dr. Sara Barba-Cabodil. Let's make it a habit to learn about good health, only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart. Located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. We would like to thank Adlaon Optical, located at ground floor Super 8 Warehouse Poblacion, Bariwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Meycauayan City, Bulacan, 0922-861-2095. Asian Breast Center is a premier healthcare facility dedicated to breast health and wellness. It specializes in breast cancer diagnostics, treatments, and disease management, offering state-of-the-art technologies in treatment guided by American standards and guidelines. Visit their Facebook page at facebook.com/Asian Breast Center PH. The Asian Breast Center is located at the 8th floor of Centuria Medical Makati, located in Kalayaan Avenue, corner Salamanca Street, Barangay Poblacion, Makati City. The center is open Monday to Friday from 9 a.m. to 4 p.m., except holidays. To get the best level of care, you can book an appointment by calling their mobile number at 0917-127-3278 or send inquiries through email ask.abc@asianbreastcenter.com. Breast cancer is curable and treatments are affordable when detected and diagnosed early. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barba-Cabodil Health and Wellness Center, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Dr. Sara Barba-Cabodil would like to express her gratitude to Medical Depot, healthy num-num food, where we do.